Thank you. It's really quite an honor to be part of this conference that's being hosted, and also to be part of this press conference. It's definitely true that the earlier these children are treated or these patients are treated, the better the results. And in some circumstances, if you don't get to it early enough, there really is not much that can be done. And so even to host a press conference to spread the word that early treatment is necessary is an advance. So I appreciate that. From my perspective, I work at a children's hospital taking care of lots of children who sustain brachial plexus injuries during delivery, during birth, which happens in approximately 1 to 3 per 1,000 live births. About 60% of the time, the injuries are mild and temporary and recover completely, but about 40% of the time, there's sufficient nerve injury that the muscles remain paralyzed. The tricky part is that if the muscles remain paralyzed and you don't restore normal nerve input within a certain window of time, probably about 1.5 to 2 years of age, the muscles can no longer receive nerve input. And what makes it more difficult is that if you repair a nerve, some of the elegant surgeries that we saw presented, the nerve that gets reconnected, remember way up in the neck, has to regrow all the way down to the targets of the muscles in the hand and the arm. And that happens very, very slowly. It takes years to get down there. And so you can't wait 2 years to decide to do the nerve surgery, which will then take 2 years to work. So you have to be able to act quickly. Moreover, when the muscles go without nerve input after birth, they're still growing, they're still developing, and they don't grow normally. And if they don't grow normally while the bones are growing and developing, the bones don't grow normally. And so there, especially in children, there can be many secondary deformities that occur, especially in the shoulder, but also in the elbow. And over the last 5 to 10 years, we've become increasingly aware that this happens very early, and that if you intervene, not just on the nerves, but on the muscles and the bones as well, you can restore better anatomy of the shoulder and better function. But we need to be able to identify the injuries and treat the injuries early, and by early, typically within the first few weeks, at the very latest within the first 3 to 6 months after birth. So I applaud the efforts to increase awareness of these injuries and the importance of early treatment. This field is evolving rapidly, and every year there are new. Every year we learn more about how important it is to do certain treatments at a young age, and so now is the time to really insist that these children get, and adults as well, get early treatment. So thank you again for the invitation to be here, and I'd be happy to answer any questions later. Thank you.